This is the Nutrition During Lactation module. My name is Kimberly PREZIOSO, and I am a registered dietitian nutritionist and a certified lactation educator. My scope of practice has always revolved around the prenatal and pediatric period of the life cycle, and a primary focus of mine is to really look at variety, balance, and moderation when it comes to healthy eating. You've already heard my professional story. My personal one, well, in terms of pregnancy and lactation, I can say that I've almost done it all. I've breastfed multiples and I've breastfed a single. I've breastfed a term baby as well as preemies, although at 7 pounds 4 ounces and 6 pounds 9 ounces, it was kind of hard to consider them preemies. I've had babies in the NICU and I've had babies that have come home right away. I've had a jaundiced baby, and I've also had babies who, after being breastfed once and then took a bottle in the NICU, never ever latched on again. And yes, he is still that stubborn today. And I've had babies who really couldn't have cared less how they received their feeding, just as long as they received a feeding. So I've also had a baby who, after fixing an ineffective suck and having to use a supplemental feeding system for a couple of weeks, refused to drink anything other than breast milk from the breast for almost 14 months. And she as well is still pretty headstrong. So I do have varied practical experience, as well as my certificate in lactation education from UCLA and years of experience working with pregnant and breastfeeding women in the WIC program at Northeast Valley Health Corporation. That being said, I am fortunate to be a part of this course where you will be given the background and tools to be effective educators and advocates for breastfeeding. And whether you have breastfeeding experience or not, enthusiasm combined with sound knowledge will allow you to make a real and lasting difference in the lives of women, children, and their families as you help them in their breastfeeding endeavors. This is a great quote to keep in mind when you look at pregnancy and lactation. So, the 1,000 days between a woman's pregnancy and her child's second birthday offer a unique window of opportunity to build healthier and more prosperous futures. By the end of the session, the student will be able to describe the nutritional needs of the lactating mother, identify how a lactating woman's diet is different from a healthy diet for a woman of the same age, including special consideration for lactating teen moms, identify levels of individual nutrients in lactating women's diets that affects the quantity of those nutrients in the breast milk, counsel mothers in determining whether particular foods might affect breast milk, and describe the weight loss recommendations for lactating women. By the end of the session, the student will also be able to understand how to safely lose weight while breastfeeding, describe the impact vegetarianism may have on breast milk and the breastfeeding infant, identify the foods a lactating woman should avoid, describe the impact that eating disorders may have on breast milk, describe the impact that maternal diet can have on breast milk, also evaluate the need for referral to health professionals. So, an overview of the course. We will be looking at calorie needs, weight loss and gain, nutritional assessments, general nutrition, special considerations, and making healthy food choices. Nutrition during pregnancy and lactation and in the first years of a child's life provides the essential building blocks for brain development, healthy growth, and a strong immune system. In fact, a growing body of scientific evidence shows that the foundations of a person's lifelong health, including their predisposition to obesity and certain chronic diseases, are largely set during the 1,000-day window that I referred to earlier in the quote. It is why it is critical that women and children get the right nutrition during this time, and that starts with the right nutrition information. Malnutrition early in life can cause irreversible damage to children's brain development and their physical growth, leading to a diminished capacity to learn, poor performance in school, greater susceptibility to infection and disease, and a lifetime of lost earning potential. It can even put them at increased risk of developing illnesses like heart disease, diabetes, and certain cancers later in life. The impact of poor nutrition early in life has lasting effects that can transcend generations, and this is seen throughout the world as malnourished women give birth to malnourished daughters who grow up to become malnourished mothers themselves, thereby perpetuating the cycle. Globally, the damage done by malnutrition during the first years of a child's life translates into a huge economic burden for countries, costing billions of dollars in lost productivity and avoidable healthcare costs. However, by focusing on improving nutrition during the critical first 1,000 days, much of the serious and irreparable damage caused by hunger and malnutrition can be prevented. Again, the 1,000-day theories, it's the 1,000 days between a woman's pregnancy and her child's second birthday. And that offers a unique window of opportunity to build healthier and more prosperous futures. Improving nutrition for mothers and children during the 1,000-day window helps ensure children get the best start to life and the opportunity to reach their full potential. And health experts agree that improving nutrition during those critical 1,000-day windows is vital. So the right nutrition during the 1,000-day window helps build a child's brain and fuel their growth, improve a child's school readiness and educational achievement, reduce disparities in health, education, and earning potential, reduce a person's risk of developing chronic diseases such as diabetes and heart disease later in life, save more than 1 million lives each year globally, boost a country's GDP by as much as 12%, and break the intergenerational cycle of poverty. Research is showing more and more that we are what we eat, and we are what our mothers ate and what her mother ate. And that being said, although high-quality nutrition leads to high-quality health, an imperfect diet still leads to breast milk being the perfect food for babies with very few exceptions. The key is optimizing health and helping families make sound decisions that will last a lifetime. Exclusive breastfeeding is a cornerstone of child survival and child health because it provides essential, irreplaceable nutrition for a child's growth and development. Nonetheless, just 38% of infants are exclusively breastfed in the first 6 months of life globally. And even though breastfeeding rates in the U.S. are climbing, the CDC reported in their last, breastfeeding report card that even though 79% of newborn infants started to breastfeed, breastfeeding did not continue for as long as recommended. And you can visit the CDC website to view those statistics. And in California, the statistics are pretty low as well. Exclusive breastfeeding has been shown to have the single largest potential impact on child survival of any preventative intervention. Besides serving as a child's first immunization, providing protection from respiratory infections, diarrheal disease, and other potentially life-threatening illnesses, exclusive breastfeeding also has a protective effect against obesity and certain non-communicable diseases later in life. So let's start right off. Breastfeeding mothers generally need more calories to meet their nutritional needs while breastfeeding. An additional 450 to 500 calories of healthy food calories per day is generally the cost of exclusively breastfeeding each day. The calories come from food as well as from fat stores. The calorie cost of 1 liter of breast milk is approximately 940 calories. Now, most women produce 750 mLs a day. Again, that's an average. Each milliliter is about 0.67 calories plus the metabolic cost of synthesis. And, most infants consume around 19 to 30 ounces a day with the cost of, again, around 380 to 600 calories a day. Examples of 500 calories per day include a peanut butter and jelly sandwich, a plain bagel with 3 ounces of cream cheese, and that's, the 2 halves. That's a Big Mac. That would be 2 street tacos with a small side of rice. To review, BMI is a measure of an individual's percentage of probable body fat based on gender, height, and weight. It is an imperfect measure, as one is not actually measuring the amount of adipose tissue versus muscle tissue, although it is a generally accepted and easy way to measure. It should only be used after the age of 20. There are other measurement standards for children and teens, such as BMI for age or weight percentiles. Both underweight and overweight status do indicate malnutrition, and both can and do impact breastfeeding. If a woman is of a normal BMI postpartum, an intake of approximately 2,300 to 2,500 calories per day for breastfeeding women versus 1,800 to 2,000 calories a day for moderately active non-pregnant women who are not breastfeeding is sufficient. The number of additional calories needed for an individual breastfeeding woman is also affected by her age, body mass index, activity level, and extent of breastfeeding, meaning exclusively breastfeeding versus a combination of breastfeeding and formula feeding. Women may need even more calories if they exercise vigorously or for long extended periods of time, if they are underweight, or if they are breastfeeding multiples. Women who are underweight are less likely to initiate breastfeeding, especially if the mom is a teen. An underweight individual may be underweight due to a number of factors, such as food insecurity or disordered eating patterns. Obesity leads to increased health risks, diabetes, hypertension, cardiovascular disease, and more. What many mothers do not consider is the hindrance it may be to breastfeeding. Obese women have 4 times the risk of not initiating breastfeeding. 4 times. Research has demonstrated that obesity may delay the onset of breast milk, as well as a delay in the prolactin response to sucking. Women who are overweight or obese during lactation also need special support. While they may have a healthy diet, there are other considerations. They may have delayed lactogenesis too, which may result in needing additional support and information during the colostral phase. Similarly, a C-section due to overweight or obesity may also delay lactogenesis. And although lactation may provide a benefit of weight loss to obese or overweight women, obese women statistically are less likely to initiate and maintain lactation, like we said earlier, due to either birth complications and or short or flat nipples, usually due to oversized breasts. Additionally, the typical American diet often falls short in vitamins A, E, C, and folate. If an obese client's diet is mainstream, these are also nutrients to look out for. Again, being at a healthy weight prior to pregnancy increases the chance for a successful pregnancy and breastfeeding experience. As well, women who are overweight or obese during pregnancy tend to have large babies, and the larger macrosomic babies tend to breastfeed for less of a period of time. Some of the complications due to obesity during pregnancy include spontaneous miscarriage, birth defects, limitations to ultrasound, gestational diabetes, hypertensive disease, stillbirth, and fetal growth abnormalities. And even though this is a slide related to pregnancy, I am including it because all of these issues or situations do have an impact on lactation. Complications due to obesity during labor and delivery, well, those can include difficulty monitoring the baby, a C-section, a decreased success of a vaginal birth after a cesarean delivery. Also, there can be difficulty with anesthesia. During the postpartum complications, there can be complications including postpartum hemorrhaging, wound infection, obesity in the offspring, long-term health issues, and malnutrition, including vitamin and mineral deficiencies. Keep in mind what I have mentioned before. Appropriate weight gain during pregnancy and being an appropriate weight prior to pregnancy is critical for a number of reasons. Returning to a healthy pre-pregnancy weight is also important, and breastfeeding can help. As with pregnancy, pre-pregnancy health, including weight, physical activity, and eating patterns, matter in lactation. In lactation, the consideration also includes pregnancy health, including, you guessed it, weight gain, physical activity, and eating patterns. Poor intake during pregnancy can lead to a multitude of barriers to overcome. Although being a mother is challenging, lactation is a normal physiological process. Women are entirely able to adapt. There are generally no major shifts in eating patterns, especially if healthy choices were part of the everyday lifestyle pre-conception and during pregnancy. All women should aim to eat well for themselves as well as their families, but should not become overly concerned or obsessed with healthy eating to the point that it becomes unhealthy. The goal is to eat well, not perfectly most of the time. The body becomes more efficient at utilizing energy and utilizing certain nutrients during pregnancy and lactation, which can boost overall health and nutritional stores of certain nutrients. Women should eat a variety of foods following the recommendations of the dietary guidelines. USDA MyPlate, which I have included in the resource page and I have discussed in the Basic Nutrition and Nutrition Education module, as well as the Nutrition During Pregnancy module, has suggestions for moms, even vegetarian moms or those looking for Mediterranean diet plans. They even have great tips on budget-friendly grocery shopping and food plans. Now, looking at hydration, hydration is important for everyone, and women should trust their thirst to guide them. During lactation, a low intake will result in less urine output rather than less milk production. There is little research to support that an increase in water will increase the volume of human milk, only that excess hydration may decrease human milk output. A helpful suggestion: have breastfeeding moms remember to think about a glass of water with every feed. They may not need it, but they should consider it. Water should be considered first, but milk and juice also count. Also counting, coffee, tea, soda, and other beverages. Those can be included in the overall count. Although women shouldn't breastfeed solely for weight loss, it's hard to argue that it is a pretty fantastic benefit. And it's one more way that the body is preparing for possibly the next pregnancy, or at the very least, the best chance at keeping up with a busy toddler. Weight loss is individualized, although it is more likely to happen for women who breastfeed. Weight loss is dependent on activity level, food selection, calories, individual metabolism, and more. The general composition of a breastfeeding eating pattern is, starting with carbohydrates, those should comprise about 50 to 55% of the diet, including 50% from whole grains. Protein should be around 12 to 15% of the diet, and that's around 1 gram of protein per kilogram of a normal weight. And fats, well, fats should make up about 20 to 30% of a healthy diet, and women should be encouraged to choose healthy fats like polyunsaturated fish or a monounsaturated avocado. Again, we're limiting saturated fats and we are limiting the trans fats. This is the first test your knowledge slide of the module. And so again, I'll read the question and wait about 10 seconds, and then we'll go over the answers. How can obesity affect breastfeeding? Well, during pregnancy, which can affect breastfeeding, if a woman is obese, she may suffer from spontaneously miscarrying her baby. There are other birth defects. There are limitations to the ability to do a proper ultrasound. Gestational diabetes may occur. She may become hypertensive. She may have a stillbirth child, and there may be fetal growth abnormalities. Now, during labor and delivery, there can be difficulty in monitoring the baby. She may have to have a C-section, and there may be decreased success of a vaginal birth after a cesarean delivery. And again, there may be difficulty in administering the anesthesia. Postpartum complications include the possibility of hemorrhaging in the postpartum period, wound infection, obesity in offspring, long-term health issues, and malnutrition, including vitamin and mineral deficiencies. Based on our previous discussions, which of the nutrients below may be lacking in the diet of a vegetarian? So protein, vitamin B12, calcium, and iron are all nutrients of concern when looking at a vegetarian diet. So protein needs during lactation. Let's look a little bit more closely at protein. So protein needs stay fairly stable throughout the entire year at about 71 grams per day. And the requirements have gone up a little bit. They used to be lower. However, the true protein requirement is based on 1.05 grams per kilogram per day. So if you do the math there, a 120-pound woman may have a protein requirement of around 57 grams per day, which is less than what's stated on the slide. A 150-pound woman will be slightly higher, and that's where the 71 grams per day would come into play. Again, it's always better to do the measurement just so that you're getting an accurate count. To give you an idea of protein content, one egg will have approximately 6 grams of protein. A 4-ounce chicken breast, around 25 grams. When you're looking at sources of protein for a healthy diet, you want to look at and include all of the sources. You want iron-rich protein like beans and lentils and eggs, lean chicken, turkey, beef, pork, fish. You want calcium-rich protein like non-fat or low-fat yogurts, cheese, and milk. You want to include plant-based protein like beans, tofu, and lentils. And again, looking at all of the different sources of protein, that will help you ensure balance, variety, and moderation in obtaining all necessary nutrients. So during lactation, 20 to 35% of total calories can come from fat. The general guidelines are to limit saturated fats like butter or higher fat meats. You want to limit trans fats like margarine. You want to remember to read the food labels, although by the end of 2018, those should be mostly phased out. You want to encourage unsaturated healthy fats like avocados and nuts and seeds. And you also want to encourage the omega-3 fatty acids, especially those from the non-mercury seafood over supplements. You can always refer back to the basic nutrition and nutrition education module because those go into a lot of these definitions and food choices extensively. Remember that fat does have a vital role in the body's ability to store energy, facilitate hormone production, help protein function, nourish vital organs, and synthesize and store vitamins. And the essential fatty acids must be obtained through the diet. Omega-3 fatty acids help control blood clotting and build cell membranes in the brain. Human milk fatty acids are synthesized directly from the body's stores of omega-3 fatty acids, which we obtain through the diet. Earlier you saw that there is actually a recommended amount of omega-3 for lactation. The level is 1.3 with a range of 0.6 to 1.2 grams a day. So we just wrapped up protein and fat, and so this is a good time to look quickly at fish. So a side note, one form of a vegetarian diet is a pescatarian diet, where individuals consume fish but no meat or poultry. Now, seafood is being more closely looked at due to contaminants that can be long-lasting. We've talked about mercury, and mercury especially can damage an unborn baby or a young child's brain and nervous system. That being said, the issue in the U.S. is generally not eating enough fish. So let's look at the benefits and the risks. So we've said that fish is an excellent source of protein. It provides several vitamins and minerals and is low in saturated fat, and all of which are excellent attributes for being healthy. Omega-3s that are present in fish ramp up the health aspect by potentially reducing the risk of premature delivery and improving brain and vision development in the baby. In 2016, the U.S. Food and Drug Administration, as well as the Environmental Protection Agency, released an Advice About Eating Fish chart to help women and parents understand good seafood choices. The initiative recommends that all women of childbearing age, especially those who are pregnant or breastfeeding, consume 2 to 3 servings of fish per week from the Best Choices list. That Best Choices list includes the 4 fish listed on the slide, the fish under the 2 to 3 servings of 4 ounces each week. Those fish include catfish, cod, salmon, and sardines. The fishes to avoid are king mackerel, marlin, orange roughy, shark, swordfish, tilefish, and big-eye tuna. And obviously these are to be avoided because these are highest in mercury levels. So even though fish is a great source of omega-3 fatty acids, supplements are widely available and they are widely taken. And if you are taking a supplement, you do actually want to look for mercury-free fish oil. Algae oil works as well. And other omega-3 sources include walnuts, flaxseed, and canola oil. And as we're finishing up the macronutrient portion of the nutrition during lactation, carbohydrates should be around 210 grams a day. Remember, that's the biggest part of the daily caloric intake. And I know I say this repeatedly, that half of the grain intake should be whole. And you want to especially limit added sugars. What role do omega-3 fatty acids play in the diet of a breastfeeding mom? And why are omega-3 fatty acids important to babies? So, human milk fatty acids are synthesized directly from the body's stores of omega-3 fatty acids, which are obtained through the diet. Omega-3 fatty acids are important to babies for brain and nerve development, immunity, and eye development. What are 3 sources of omega-3 fatty acids? Well, I've listed several, but 3 sources of omega-3 fatty acids include catfish, cod, salmon, sardines, and supplements like mercury-free fish oil and algae oil. Other omega-3 sources include walnuts, flaxseed, and canola oil. This concludes Nutrition During Lactation, Part 1.